Well, hello there. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, Canaan. Today, neuropathy. Well, we have a program called Neuropathy CoreHealth, and we've been doing it for several years with, I think, a good amount of success in helping people with peripheral neuropathy. Now, typically, your neuropathy is going to come from one, chemotherapy. The chemotaxic agents destroy the covering on the nerve, and that creates a problem. Or diabetics who, if their blood sugar is not under control, again, you destroy the sugar content will destroy the covering on your nerve called the myelin sheath. Now, the last the more common type of neuropathies is the one with if you drink too much. Okay, so I really want to focus on today is if you're really looking to get help with neuropathy, there's no pill. Okay, the better fact if you go to your primary care doctor, they say there's no cure. But we could try gabapentin, which is an anti-seizure medication, Lyrica, Cymbalta, all in this kind of same classification. So what you're doing is, you're going to quiet the nerve. You might get to sleep, but after a while, they don't continue really to work that well. So you're really kind of you're up the creek without a paddle per se. But here's the thing: is when we take a patient on, the patient's got to understand. This to you is like there is no pill that's going to solve your neuropathy. There are advanced therapies that can and will help optimize the situation. Okay, a nerve like any other cell needs a couple things. One, it needs glucose for fuel. It needs oxygen and needs stimulation, and that's kind of what we really focus on. Is basically getting people getting the nerve cell stimulated, getting proper amount of glucose to it, and then also, stimulating it as well. So you have several things that we do, and we do it pretty well, that a pill is not going to do. I mean, right now, the average American is on 4 medications, and we're the sickest nation, and we spend the most on healthcare. So something is drastically wrong here. And if you believe that my doctor says to take this, and boom, you're not going to get any results. So the problem with peripheral neuropathy, as I see, is it erodes the quality of life slowly. It's not a quick thing. All of a sudden you wake up and you can't go to sleep at night because your legs are burning, or the pain gets worse at night, which does tend to happen. So it's almost like a team effort. I mean, if you're not going to watch your diet, if you're not going to do the home therapies, because in order for what we do here in Neuropathy CoreHealth to work, you have to do your part. And if you're not doing your part, there's nothing, it's not going to succeed. And listen, I'm going to tell you up front, Medicare doesn't cover it. Medicare covers sick care. And neuropathy is usually due to one other reason, that you have it. Like I said, the diabetes, the chemotherapy, or drinking too much. But you got to do your part. If you're a drinker, I tell you the truth, I don't even take people who are alcoholics into the program because it's not going to work. That's a lifestyle change that you need to focus on. Now, the people who are diabetic and the people who have the chemotherapy, we can see really great results, but you got to do your work at home, and you got to do it on a regular basis. It's like, I'm not saying like once a week. I'm saying some of the stuff we send people home with, because most of the therapy we do is in home. And if you're doing the work at home, you reinforce the change that we try to do. So there's a LED laser we send people home with, and I see a lot of results with this because what it helps doing, it helps to vasodilate. Now, what's vasodilation? Vasodilation is opening up blood vessels that allow blood flow to get to the nerve to help heal the nerve. Now, if you're taking the right supplements and you're doing that as well, now you're going to be able to get more nutrients to the nerve. And the B vitamins are the real big players. I mean, there's a couple of ones as well, but the B vitamins are very important for nerve conductivity. So again, you got to do your part. You got to watch your sugar. If you're diabetic, you got to watch your blood sugar. Listen, if you're at a wedding and you have a dessert, it's not the end of the world. But for the most part, you got to get more. You got to buck up on the conscious level of what you're eating and what you're putting into your body to make a difference. And that's the thing here is because a lot of the programs we put people on are 3, 6, 9, 12 months. But what is the cost of you not doing it as you start to lose your balance? You're more at risk for falling. Your sleep is impaired. You're in a lot more pain. Another thing too is pain is very different than numbness and tingling. Pain, you're going to act on. Numbness and tingling, you're like, well, you don't feel it, it's no big deal. But try running your car with the oil light on for a couple thousand more miles to see what happens. Well, that's basically what you do with your body when you just, if you're not in pain but it doesn't hurt, well, keep driving and see what happens. Well, if your engine doesn't seize after a period of time, then you're lucky. But here's the thing: is you have to be responsible for your health care. And if you're relying on doctors who are just going to push a pill, take this, go here, do this, let's do this test, that test, you're not going to get anywhere. So Neuropathy CoreHealth, we have a program called the Precision Nerve Reset. And chances are you've gotten my PDF. It's a pretty informative book, goes over the whole program. Now, number one, I said it earlier, Medicare does not cover the cost. You have to look at, is your health, is the quality of your life worth investing in? And if it's not, well, take the pill. See what it does for you. But if you're really serious about getting help with your peripheral neuropathy, then I encourage you to come in and take what we call the advanced nerve sensitivity test. There's 9 different types of nerves in your body. Only 2 deal with pain. I'm not looking for the pain ones. I'm looking for the other ones because it tells me a lot more information about how your body's functioning and what we have to do to, jumpstart, do the jumpstart like you do it when your battery dies. When your battery dies, you call AAA. When your nerves die, you call Neuropathy CoreHealth. And it's a very effective program. Like I said, the in-office stuff, we can do a bunch of different therapies. Probably the one I like to talk about most, we're going to end after this, is blood flow restriction, okay? When you're sedentary, okay, you can't feel your feet, your balance is off. You're going to sit on that couch, you're not going to move as much. Well, that happens. Now you're not getting as much blood flow. Blood flow is essential for the nerve, the muscles, everything in your body. Blood flow restriction is a very powerful therapy where we put these tension bands on your thighs and use a high-speed vibratory plate to exercise. And what it does is it creates a deficit of venous return. So the blood flow is not getting back. It's getting to it, but it's not going back. And then all of a sudden, when we're done with the therapy, which is painless, by the way, all of a sudden you're going to get this blood rushing in, and that helps to heal the nerve and bring the nutrients to the nerve so the nerve can function properly. So that's one thing. A lot of times too is people aren't, if you're anemic or you're not getting enough oxygen, well, sometimes we have you do exercise with oxygen to get the whole benefit of therapy. If you oxygenate, because you do need oxygen to the cells to thrive. So oxygen is a big player with it. Now, I said I was going to end soon, but inflammation, that's where you have to do your part at home. You have to make sure you're eating right. You have to make sure you're not drinking too much or at all. And you have to do your part as far as taking certain supplements, eating right, exercise at home. And that's what I would encourage you to do. So one, there is hope for people with peripheral neuropathy. And the program works, and it's very, very effective for the people who follow through the program. It is not a quick fix. There is no quick fix with peripheral neuropathy. I'm Dr. Brian McKay. I'm not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Have a great day. Thank you.